always been a proud amateur athlete. I regularly exercise. I enjoy golf, tennis, bike riding. My neighbor was in a bowling league. He said, well, we actually need another player on our team. And so now this is my third year bowling in the senior bowling league. About a year ago, I started feeling the pain in my hip. When I was bowling, it was pretty intense pain when I was releasing the ball. My hip pain became so intense that I had difficulty walking up and down stairs. That made me feel old, and getting old stinks. About a month later, I was experiencing very intense pain daily in my hip, and that's when I sought out Dr. Poorman.
I met Tim for the first time, and he was, like many patients with severe hip arthritis, having a lot of pain. His x-rays showed wear and tear of his normal ball and socket joint.
Dr. Poorman told me that it really was bone against bone. It was very, very rough abrasion, so there's no wonder I was feeling the pain that I was feeling. And sure enough, he said, there really isn't a better alternative than hip surgery. I thought that when I would have hip replacement surgery, that I would be more or less disabled for 4 weeks, 8 weeks, a whole year after surgery. I was very reluctant to do it, but Dr. Poorman said, the way I do it, you may be up and moving sooner than you think.
The nature of hip replacement surgery in general has dramatically changed over the last few decades. The techniques have really been fine-tuned in recent years. We've been able to kind of move towards smaller incisions, less invasive surgery overall to still accomplish a very good end result. Traditionally, the majority of these operations were performed via the posterior approach. So with an incision on the side of the hip, you have to kind of split through the gluteus muscles to get down to the hip. That has changed with direct anterior hip replacement. We are accessing the hip from the front and not disturbing some of the soft tissues, the muscles, tendons, ligaments in the back of the hip.
And that's when Dr. Poorman explained, because he's not cutting through muscle, tendons, and so on, that the recovery time would be much quicker. And I'd be able to get back to all of the activities that I want to enjoy. So it's all I needed to hear. After the surgery, I felt great right away. I was walking without any aid device 3 days after surgery. I just felt like my recovery was almost instantaneous. Today is 5 weeks after surgery, and I absolutely feel like I got my life back. I was driving less than 2 weeks after surgery. I started bowling 20 days after surgery. People in the bowling league were amazed that I was out there bowling that soon.
Tim has had a great recovery and is off to an excellent early start after his hip replacement. I think an anterior-based approach can be powerful for people on a wide spectrum of activity levels.
All of my experience with Penn Medicine has been very, very positive. From Dr. Poorman to the front office staff, to the nurses that I've worked with, the physical therapists, they've all been outstanding. I feel like I have the rest of my life to live the way I want to live it. I feel 20, 30 years younger than I did before surgery. I just couldn't be happier with the results.